So from that, we were able to see that he, had his labs drawn, and we were able to see the radiology report that there was in fact a fracture and that he was scheduled for surgery. So this allowed our team to contact the hospital, explain that his follow-up care is already in place, so it's not something that they would need to spend time constructing or creating, and it allowed us to coordinate the care and be prepared for his discharge well in advance of any of that happening.
We met with him several times in the shelter, and eventually we lost contact with him. He was not in the shelter. He did not have a phone. We received a notification that he was in our emergency department with frostbite. And so we were able to intervene. He ended up needing an inpatient hospitalization. We've re-engaged services with him. We're working on housing with him. We've actually found some family supports. Our case manager has reached out to some family supports that actually are starting to re-engage with him as well.
It was sort of through an unfortunate circumstance where he had overdosed, and when we looked into the record for the ER, we saw the prescriber's name and the medication that he was prescribing. So our psychiatrist contacted that psychiatrist. That psychiatrist alerted us to look even further in to see that he was in fact also receiving the Suboxone from another provider. And this allowed us to really sort of prevent a duplication, or in this case a triplication, of the prescribing practices, and certainly improve the quality of his care.
We used Health InfoNet to find out where he was. He was outside of our system. In a medical hospitalization for a very appropriate reason. So we were able to provide, with his permission, provide that information to his lawyer so that that prevented his incarceration, and to our outpatient providers so that they did not discharge him. After he was discharged from the medical facility, he re-engaged with our outpatient services, and he did not go to jail. So he's still engaged with outpatient services now, and this is one of the longest times that he's been free of incarceration or inpatient hospitalization.